Facebook Live session. Today our topic for discussion is Cardio-Renal Syndrome. And for our discussion we have with us Professor Dr. Partha Saradhi, SV Consultant in Nephrology and Transplant Physician at Apollo Hospital, DRDO, Hyderabad.
Namaste.
So, few lines about Dr. Partha Saradhi is in a clinical practice in last 16 years. Areas of interest: diabetic nephropathy, glomerular disease, hypertension, Cardio-Renal Syndrome, and AKI and CKD retardation. Professor of Diabetes at IMA Hyderabad Board Examiner. Achievements: published research papers in national and international journals, gold medalist in all Indian medicine exam at board level of national and international board of medical exam, and gold medalist at UG and PG level. So dear viewers, if you have any clarifications, please leave them in the comment section. Doctor will be answering during the session. So let's start our today's session. So doctor, what is Cardio-Renal Syndrome?
Namaste everyone. Today's topic is Cardio-Renal Syndrome. See, as the name suggests, cardio, heart, renal, kidney. Syndrome means a group of diseases. Patients who are having a combination of heart and kidney disease is called Cardio-Renal Syndrome. It is usually of 5 types. Type 1, if there is sudden cardiac problem and development of sudden kidney problem, it is type 1. Type 2, if there is pre-existing heart disease, development of new kidney problem is type 2. Type 3 and type 4 are: type 3, those patients who have sudden kidney problem, acute kidney problem, suddenly developing a heart problem, it is type 3. Type 4 is those patients who are already suffering with chronic kidney disease or continuous kidney disease, suddenly develop heart problem or heart failure, it is type 4. And type 5, which has multiple combination, it is called type 5 Cardio-Renal Syndrome. So basically it's a combination of heart and kidney disease.
So what are the symptoms of Cardio-Renal Syndrome?
Symptoms of Cardio-Renal Syndrome, usually if the patient has got sudden heart attack, as in type 1, develop chest pain or palpitations, and they have ECG changes, suddenly they can have a rise in the creatinine. Creatinine is a marker of kidney disease. If the creatinine rises, that means that the patient has got a heart attack and a kidney problem. In type 2, usually they have swelling of the feet, breathing difficulty, and raised creatinine. Again, in type 3 and type 4, there will be elevated creatinine and development of sudden chest pain or breathing problem or swelling in the feet, or sometimes reduced urine output. And in type 5, they can have different symptoms like breathing difficulty, swelling of the feet, reduced urine output, palpitations, or fever, and any sepsis. This can cause type 5 Cardio-Renal Syndrome.
So how can one develop Cardio-Renal Syndrome?
Depends. For example, a patient is a diabetic, not properly treated. He can have both cardiac and renal disease one fine day. This can be especially seen in type 2 diabetes mellitus. Smokers, these have got elevated cholesterol. An elevated cholesterol will cause a high blood pressure. All these 3 together will increase the risk for development of Cardio-Renal Syndrome, especially untreated diabetes, untreated hypertension, or smoking, family history of heart disease, patients who have got kidney disease previously, or patients who are frequently passing albumin in the urine, they are more prone to develop this type of Cardio-Renal Syndrome. Moreover, patients who are taking painkillers or herbal medicines without proper justification under the treatment of a proper practitioner can also develop kidney disease that can cause heart disease. And high intake of high cholesterol diet, high salt diet can develop Cardio-Renal Syndrome. These are the risky population. Obesity also is a high risk for development of Cardio-Renal Syndrome.
Then how to identify
Development of Cardio-Renal Syndrome? Or if a patient is having elevated, think that he has kidney disease. So a heart patient can have a kidney disease, or a kidney disease can have a heart disease. So, it is a combination.
So, do any habits
Style. Not eating on time, eating high salt diet. Example, pizzas, burgers, chips, time pass snacks, uncle chips, whatever, I do not want to name, snacks, high salted bakery items, high non-veg intake, high oily food intake. These 5 in the food intake. Number 6, increase of protein intake in the form of, say, whey protein. Nowadays I am seeing youngsters going into the gym taking 3 to 20 grams of creatinine compound. That predisposes to heart disease. That one type of lifestyle. Second, sedentary lifestyle. Business people, then medical professional people, those who are not accustomed to at least doing 20 to 30 minutes of walking. Fifth, improper food intake, that is, they take morning once and night, that is all, not following dietary advice of diabetic advice. This is a temporary shutdown. Usually it is a temporary dialysis requiring 3 to 5 sessions, and if the cardiac function improves, it will not require. However, in elderly patients, those who have already pre-existing renal disease with a creatinine of 3-4 with a glomerular filtration rate less than, say, 30, these are the population who can have at risk of developing permanent dialysis. Usually many of the patients who require temporary dialysis for acute kidney problem in cardiorenal syndrome do not require lifelong dialysis.
So, one of our audience asked a question, what is the relationship between heart failure and renal failure?
Yes, in both these conditions there is a high risk for generation of endothelin hormone, which is a very potent vasoconstrictor or a which causes tightening of the blood vessels. This will further aggravate the activity in the circulatory system, causing high cholesterol, hypertension, which can aggravate heart disease. Not only that, in heart failure or in kidney failure, there will be high levels of fluid overload and pro-BNP, that is brain natriuretic peptide, which is secreted by the atrial receptors from the heart. When there is high pro-BNP, even in heart failure or kidney failure, which can aggravate the more waterlogging, causing interstitial edema in the kidneys as well as the heart and the lungs, thus causing high venous pressure in both the systems, thereby damaging the blood vessels and reducing the blood supply to the kidney as well as the heart. So, it will worsen heart failure and renal failure.
So, one more question from audience, sir. Why do kidney fail after heart surgery?
There are multiple causes. One is whenever there is any development of intraoperative ischemia or intraoperative blood supply reduction to the heart, will cause reduced blood pressure. Second, development of reduced blood pressure, low blood pressure or hypotension causes reduction in the blood supply to the kidney, causing temporary shutdown of the kidneys. Not only that, sometimes patients can have idiosyncratic reaction. Sometimes the medicines which can be used very rarely can cause a interstitial nephritis in the kidney, causing kidney injury.
So, doctor, please tell our audience about nephrology at Apollo DRDO.
The nephrology at Apollo DRDO is a well functioning department. We have 24/7 services with dialysis and ICU dialysis therapies. We have established a urology division which has got stone therapy, as well as we have both outpatient and inpatient practices, and patients from all corners of the city will come, including nowadays we are getting from all India level also. And thanks to the services offered, we are very happy that we have got inpatient and outpatient dialysis therapies, maintenance hemodialysis therapy and acute kidney therapy in ICUs.
So, dear viewers, we have come to the end of